Assalamu alaikum. I am Dr. Silvia Paroi, Assistant Professor of Community Medicine Department at the Akij Medical College, Khulna. Today we learn about the tools of measurement in epidemiology. It is our second lecture on epidemiology. So we start to see the tools of measurement in epidemiology. There are three tools: rates, ratios, and proportions. Now we see what is rate. What do you mean rate? A rate measures the occurrence of some particular event, development of disease, or the occurrence of death in a population during a given time period. That calculated by number of events in 1 year divided by mid-year population multiplied by 1000. This is number of events in 1 year. It's a numerator and denominator plus mid-year population. Now we see various categories of rates are: 1. Crude rate. These are the actual observed rates such as the birth and death rates. Specific rates. These are the actual observed rates due to specific causes. Example, tuberculosis, or occurring in specific groups like age, sex groups, or during specific time periods, that annually, monthly, or weekly rates. Standardized rates. These are obtained by direct or indirect method of standardization or adjustment. Example, age and sex standardization rate. Now we see what is ratio. Ratio is the results of dividing one quantity by another. It is expressed in the form of X is to Y. Example, the ratio of white blood cells relative to red cells is 1:600. That meaning for each white cells there are 600 red cells. Other examples include sex ratio, doctor population ratio, child-woman ratio, etc. One thing you have to know that numerator is not a component of the denominator in ratio. Proportion. Proportion means magnitude of a part of the whole. The numerator is always included in the denominator. A proportion is usually expressed as a percentage. Thus we place in numerator portion the number of children with scabies at a certain time, divided by, in denominator we place total number of children in the village at the same time, that multiply with 100. So it expressed as a percentage. Now we see concept of numerator and denominator. What is numerator and denominator? At first we see numerator. Numerator refers to the number of times and events, example sickness, birth, death, episodes of sickness, etc. has occurred in a population during a specified time period. The numerator is a component of the denominator in calculating a rate but not in a ratio. What is denominator? Numerator has little meaning unless it is related to the denominator. The epidemiologist has to choose an appropriate denominator while calculating a rate. It may be related to the population, related to the total events. Now, what is incidence? Incidence rate is defined as the number of new cases occurring in a defined population during a specified period of time. It is given by the formula number of new cases of specific disease during a given time period divided by population at risk during that period multiply with 1000. Special incidence rates are attack rate and secondary attack rate. An attack rate is an incidence rate usually expressed as a percent, used only when the population is exposed to risk for a limited period of time, such as during an epidemic. Secondary attack rate. It is defined as the number of exposed persons developing the disease within the range of the incubation period following exposure to a primary case. Now we see the uses of incidence rate. The incidence rate as a health status indicator is useful for taking action to control disease and for research into etiology and pathogenesis distribution of diseases, and efficacy of preventive and therapeutic measures. Now we see what we mean prevalence. The term disease prevalence refers specifically to all current cases. All current cases means old case and new case existing at a given point in time or over a period of time in a given population. Prevalence is of two types: point prevalence and period prevalence. What is point prevalence? Point prevalence of a disease is defined as the number of all current cases of a disease at one point of time in relation to a defined population. Such as in present situation, if we calculate the total at one point of time, the total case of COVID-19 patients, then include old case and new case at one point of time. This is called point prevalence. Period prevalence. It measures the frequency of all current cases, old and new, existing during a defined period of time, such as annual prevalence, expressed in relation to a defined population. That like COVID-19 patients in 2020 from January to December. If we count it, then it is called period prevalence. Uses of prevalence. Prevalence helps to estimate the magnitude of health disease problems in the community and identify potential high-risk populations. Then prevalence rates are especially useful for administrative and planning purposes. Example, hospital beds, manpower needs, rehabilitation facilities, etc. Relationship between prevalence and incidence. Prevalence, that means P equal to incidence I is to duration D. So from above equation, it shows that the longer the duration of the disease, the greater its prevalence. Thank you everybody.